Happy Thursday, everybody. It's Chamber Check-In time. And today I have co-owners of the Boise QC Kinetix with us today, Ben and Renee Rippey. Hi.
Hey, everybody. Hey, Paul.
Hey,
Thanks
guys.
for having us.
Hey, Chamber members.
Hey, thanks for carving out some time to help me understand more about QC Kinetix and let the listeners understand as well. And we love to feature our members, and we've been doing this program for about 2.5 years. And with that, I'd like to thank our series sponsor before we dive into QC Kinetix. And a little bit of your background. Delta Dental, Ben and Renee have been sponsoring this series, and they offer best-in-class dental insurance benefits to businesses like yours, citizens and community members. They have some great programs out there. And with that, I'm going to share a fun video from their Tooth Truth series. Here we go.
Did you know that the electric toothbrush first appeared in 1939?
So I wonder if the electric toothbrush in 1939 was the size of the car phone in the mid 80s.
Yeah.
What did that look like? Yeah.
And you and I were talking about electric toothbrush, and you both use electric toothbrushes.
Yeah.
Absolutely. There's no other way. You have to use one. It makes such a difference in your dental health for sure.
Mm-hmm.
Yeah, both of us have gotten the recommendation to use an electric toothbrush, and
both of us have gotten accolades and
Yes.
applause from our
Yay.
dentist for having made the switch.
Yeah.
So it's
well worth it.
It's a big difference, a big lifestyle improvement.
That's awesome. Well, thanks again, you two, for not only joining the chamber, but carving out a little bit of time to help share the story. So what I love to do with these is learn about the people first, and then we'll dive into the kind of the origin story of QC Kinetix. So Renee and Benjamin, tell us a little bit about your history of work that led you to become entrepreneurs in the healthcare industry.
Yeah, thanks, Paul. So both Ben and I, worked in corporate America. We both had those kind of typical corporate jobs, and Ben worked in, media relations for 20 years. I worked in the fragrance industry for 20 years. We've been married for 13 and a half years and kind of always shared the goal of wanting to be business owners. But we weren't the type to just rush out and just find any business. We really wanted to take our time and find something that was meaningful to us and that we could be passionate about. So years went by, literally. We wanted to kind of stumble on something organically. And that's exactly what happened. We
came out to Boise about 5 years ago for Renee's job. At the time I was consulting.
Mm-hmm.
And Idaho just is a great community for business. It is a pro-business, families.
Yeah.
And and we found this opportunity to get involved in a company that was in an organization that was doing work that was really meaningful, that meant something to us.
Yeah. So Ben was, he had received the type of treatment that QC Kinetix is involved in. He had gone, but he had to travel to a long distance. He had to go to California for those treatments, and benefited greatly from the treatments. And
I've been a patient.
Yeah, so he's been a patient
first.
And then that's important. And also, the other side, and once we get more into what we actually do, but which is really helping people restore their joint health. Ben's mom, we had gone 10 plus years watching his mother struggle with her joint health, her knees.
She had a double knee replacement, and one knee was good, and the other knee has never been right.
And she has to get it redone.
She's got to go get it corrected, which is just an order of magnitude more challenging. So, to be able to offer, if we could have rewound 10 years to be able to offer this to my mother, she might have benefited from this. She might have saved herself a decade of discomfort and
inactivity. Yeah. So that's kind of how we got into, being business owners, and then finding QC Kinetix, which is this fabulous organization that we just felt so passionately about because they were, quickly growing. They had the practitioner, medical community behind them, research, studies, patients going on over 10 years, living wonderful lives. So that was very appealing to us to be part of that community and bring those benefits here to Boise.
So is QC Kinetix kind of a franchise that you have purchased?
Yeah.
Okay.
Yes.
I would imagine the goal is to grow and offer the services to, maybe 3 or 4 or 5, 10 clinics. Well,
so it's a network of clinics, 150 plus in 30 states.
Oh, wow.
We brought this clinic to Boise last year. But QC Kinetix as an organization, we've been treating patients for going on 10 years. So it's an established science and an established group of people.
I've been hearing advertisements for QC Kinetix on the radio.
Mm-hmm. Good. Yay. We love hearing that.
It works.
It's working.
It's working. It is. Yes. It's our
and I love alternative opportunities to surgery. So why don't you tell us a little bit about the deep dive of, you've mentioned 10 years of QC Kinetix offering services in 150 locations across 30 states. That's kind of the origin story. Is there anything you want to add about the origin story first before we go into some of the services that you provide?
Well, the only thing I would say is that these are treatments that have been available essentially only to professional athletes and thoroughbred racehorses these have been around 10 or 15 years. It is only just now that it's available sort of at the consumer level. Mm-hmm. So this is not new science. It is established. And the specifics that we're talking about is natural treatments for arthritis and other joint conditions, sports injuries and arthritis. So using the patient's blood. Our ethos is that you have in your bloodstream all of the building blocks of new, healthy, soft tissue. Mm-hmm. And the problem is that the joints, the knees, the hips get very limited blood flow, which limits their ability to regenerate from that wear and tear. So, you get to be 60 and you start feeling it. And what we're able to do is take your blood and the individual components of your blood, plasma, platelets, stem cells, and a specific protein, isolate those, super concentrate them at levels that your body can't duplicate naturally, and put it back into the joint in a very specific order, guided by ultrasound, so that we know exactly where we're going, in an order that mimics your body's natural healing progression. So we can regenerate worn joints non-surgically. And that is the promise. That is where the science is now.
Okay. Well, that's just incredible to be able to offer that. Is that offered anywhere else in Idaho?
So you see, or we've seen and we've heard, because we've had patients who might have gone to, it's very difficult to find, but if you do find it, sometimes, a chiropractor might, offer it.
PRP it's something that's more commonly offered. Some orthopedic offices are doing it, but it's more like let's try and see. Let's see if this brings you any relief. We have 10 years of data backed by this protocol that it's a regimen of 5 injections. And it is a shot. It is an injection directly into the joint. We anesthetize the area and we numb it up so you don't really feel much. But yeah, in terms of the protocol that we deliver, we are second to none. You might have heard of people doing PRP, but we have it PRP into a regimen including these proteins, the stem cells of the person's own body.
Wow.
And a class 4 deep tissue laser. All these treatments taken together have been, we've seen a magnifying effect in terms of their efficacy. And I also think it's just quickly, it is important to mention stem cell therapy people talk about ethical concerns.
Hmm.
This is not, so I just want to be clear, this is not fetal tissue. This is not umbilical cord blood. This is patient's own stem cells.
Yes.
We are harvesting them from the patient themselves. So there's no concerns on that end. And people do come to us asking where we're sourcing from, and we can tell you with a clear conscience, nothing is going into you that didn't come out of you.
Wow. Okay. Well, that's news to me. I had no idea. We had a listener ask if this was a PRP shot. I've never even heard of that. But so I'm learning stuff new here. And so the service that you offer is this stem cell regenerative. Okay.
Regenerative medicine. The broad umbrella term is regenerative medicine.
Okay. And then what type of conditions are treated? You mentioned joint pain and arthritis. What other things?
Arthritis, tendonitis, if you've got tennis elbow, golfer's elbow, bursitis, if you have a bulging disc, if you've got degenerative disc disease in the back, that's one of the most common things that we treat, and for which there are very few surgical options that are appealing for patients.
Okay.
If you've got degenerative disc, a laminectomy or a spinal fusion is typically what an orthopedic will tell you, will recommend to you. The risk profile is high. I always tell people that, there is no going back from surgery. Once you've been operated on, that there's nothing more I can do for you. So you owe it to yourself to try other things, because you may not be happy with the results of surgery. Surgery changes the way that you interact with your body. It changes the way that you move, your flexibility. So, ask anyone who's had a double knee replacement. They will tell you, you don't get down on your knees anymore.
Right.
You're not skiing anymore. It's those things, those lifestyle considerations.
And I think, the important thing, Paul, too, is that there are, some people want to have surgery, and that's fantastic. Great. You should absolutely do what you think is best for you. But I think that, what we see is a lot of people who are looking for an alternative.
Yeah.
And I think something that we're really passionate about is just educating people that this is even an option for them.
Right.
Because a lot of people we have heard the ad on the radio, come in and say, I never knew about this before. I had no idea.
Yeah.
And so, I think it's just really wonderful to be able to be in a forum like this, other forums where we can just even let people know that this is an option. Some people have had one joint replacement. They don't want to go through it again, or they're just not a fan of surgery, and that's okay.
If you're 70, if you're 68, 70, and your only goal is to be up and around and to be able to,
play with your grandchildren,
go to the grocery store, without pain, surgery can be a good option for you. But if you are a working person, an active person, they very often understand that surgery is terminal. There's no making a change once you've made that decision. So we have people who come to us because they can't take time off work. They can't spend 6 months in rehab. They're business owners. They are a lot of business owners who are in charge of their own destiny and who oversee operations in any number of fields, and for whom an absence would be catastrophic.
Yeah.
I get it. Where are you located?
We're on Overland. Between Maple Grove and 5 Mile.
Yeah.
Okay. Are there any other QC Kinetix in the state of Idaho?
We're about to open a location in Idaho Falls, but other than that, we are the only one.
Oh, that's great. I'd love to see
Eugene, Oregon, I think.
Okay. Well, and that just says a lot about the brand. And we did have a question from a listener. Does insurance cover QC Kinetix?
Very, very good question.
Yeah.
So the answer is no.
Unfortunately.
This has been designated as experimental, even though we've been doing this, as I said, it's been around for 15 years. There are political reasons for that. There's an awful lot of money tied up in the standard of care, in medication and then joint replacement. That's the way things have been done. That's what people are accustomed to. But I think in the next 10 years, you're going to see the insurance companies wake up to the fact that you can either spend 6 figures on a joint replacement, or you can spend, a fraction of that on treating the patient in a different way and getting the same result.
Or better.
Yeah.
Well, Renee and Ben, I put your website here up on the screen for people to check it out. Hey, while I have you for another couple minutes, is there anything else that you'd like to educate us on about QC Kinetix?
Well, there is one thing, and that is that if you've heard about PRP, you may have heard about its applications in aesthetics, in the use of facial rejuvenation, and in my case, in hair regeneration. I was mostly bald up here. I had very, very thin hair, and I had 6 treatments of PRP over the last year and a half, and I have been blown away by
this thick, lustrous hair that you have.
Right.
And they likes it.
I'm not quite thick and lustrous. I'm certainly not where I was when I was 20, but
no, it's amazing. I mean, I think what's cool, especially with Ben, it's like, you start losing hair, and with PRP, it's like, get in there. You can start treating those areas,
right?
And all of a sudden, you're restoring your hair, and you have more hair, so it can start, preventing additional loss, and then helping you regrow what you've already lost.
All right, okay.
So,
well,
we're launching hair restoration,
yeah,
right now.
Yeah,
so
so
we're adding that to our service offering.
Yeah, so that's exciting.
Ben and Renee, I just want to thank you for your time and kind of recap our conversation. So QC Kinetix offers an alternative to surgery if you're having joint pain, hair restoration, other types of services that are provided. You're on Overland between 5 Mile and Maple Grove. And there's another QC Kinetix that's opening up in Idaho Falls. And you're a chamber member. So we love doing business with businesses that invest in their community.
A chamber member, a member of Leadership Boise, a believer in your mission, and an appreciator of you guys.
Absolutely. Thank you so much for that investment. Thank you so much for bringing this to Boise, and really appreciate you carving out some time with me today to help educate the listeners and myself more about what QC Kinetix is. And also, you have a spokesperson that's been involved with QC Kinetix. Why don't you we'll adjourn with that.
Yeah, Emmett Smith is our at a national level, our spokesperson. And I know we got a lot of Cowboys fans in Idaho.
Yeah.
A lot of NFL fans. So, he's the leading rusher in the history of the NFL. He knows about pain, and these guys get beat up. And they know the value of these treatments. Yeah. So we are so appreciative and welcoming to him for giving his name to our brand.
If it works for Emmett, it's got to work for you. So that's awesome. All right. Well, hey, thanks again for your time. Have a great weekend.
Thanks so much, Paul. Appreciate it.
We'll talk soon.
You too,
All right.
Paul.
Take care.
Thank you.
Thanks, everybody.